Hi, my name is Faith Jordan. Student ID is 3630837, and I am going to be going through the task demonstrations for veterinary nursing care fall semester 2024. And today I will start off by showing you how to obtain a patient's history and give that information and round to the doctor. I just want to show my blank treatment form here before we start that I do not have a script in front of me. Hi, my name is Faith. I'm one of the technicians here. It looks like we have Fredonia in today. Is that correct?
Yes.
All right. And what's she coming in for?
She has just so much goop on her eyes. Every single morning I have to take a washcloth and clean off her eyes because she can't even open either of them.
Both of them? Okay.
Mm-hmm.
Any color to that discharge?
Yeah, it's like a mucusy green yellow color.
And when did that start?
That probably started on Tuesday morning, I want to say.
Getting better or worse?
No, it's definitely getting worse. Because then I believe on Thursday morning, she started sneezing.
Okay. Any changes with the sneezing? Is she having any discharge from that?
Yes, she has green, the same color that's like near her eyes is coming out of her nose when she sneezes, and it's just getting everywhere.
Okay. And is she indoor, outdoor, indoor only?
She's indoor, outdoor.
And is that discharge coming from both nostrils?
Yes, I think so.
Okay. And has that gotten better or worse?
It's getting worse. She's starting to look really sick.
Okay. Any changes in her behavior since this has started?
I think she's a little bit more lethargic. She just kind of lays around a lot.
Okay, still eating and drinking okay, or any changes with those habits?
She's still eating and drinking pretty normally.
All right, and is she up to date on her vaccines?
Yes.
Is she current for her FERCP, which is that kitty distemper? There's feline leukemia, and there's the rabies. When would be the last time she got those?
I don't know what she gets, but she's due for it this month, so she should be up to date.
Okay, do you know when the last time is that she had them?
Last year, around the same time.
Is she on any medications or preventions that she gets, or supplements?
She's on a flea and tick preventative. I apply a Frontline on between her shoulders, and she did go to the vet last weekend to get dewormed.
Okay. Do you know what she was dewormed with?
I think it was maybe Panicure.
Okay. Now with the sneezing and the eye discharge, is she having any coughing with this?
I don't see any coughing.
Any vomiting or diarrhea?
No, not that I've noticed. She does have a little bit of a looser stool, but other than that, normal.
And no changes to her diet?
Mm-mm. She does like to get into the dog food occasionally.
Okay. All right, so I've got that she's having eye discharge that is that greenish yellow mucopurulent in color that started Tuesday morning. And then Thursday that progressed to sneezing, and she had the same amount of discharge or the same color of discharge coming from both nostrils. Mm-hmm. She is indoor, outdoor. She's a little lethargic. She's still eating and drinking fine, going to the bathroom okay with that occasional loose stool. Does she have any history of anything like this happening before?
No, she's been a healthy cat her whole life.
Okay. And I do have her as a 4-year-old spayed domestic short hair, black and white in color.
Mm-hmm. That's my girl.
All right. Well, I will get this information to the doctor and we will get back to you.
Awesome. Thank you.
Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be filming how to round your history that you've obtained to your doctor for veterinary nursing care fall semester 2024. Doctor here. I have your next one. Her name is Fredonia. She is a 4-year-old spayed domestic short hair feline. She's here for ocular discharge, mucopurulent color that started Tuesday, 9/3. That progressed to sneezing, mucopurulent discharge from both nostrils. Thursday morning on the 5th, she is indoor, outdoor. She is slightly lethargic. There's no coughing, vomiting. She's having some loose stool, but she was recently dewormed with Panicure last week. We're unsure on the vaccine status. Owner said she's not sure what she's got, but she might be due for them this month because she had them this time last year. She does get a flea and tick topical prevention monthly. Other than that, seems to be doing well. My name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating how to perform a TPR, so temperature, pulse, respiration, and weight, as well as checking mucous membranes and CRT, which is capillary refill time, for veterinary nursing fall semester 2024. So I have got Rigby here, who's been hospitalized for HGE. I've got the scale on at 0. Hi, Rigby. And I want to make sure until she's completely still on the scale with all body parts. All right, 15.9 kgs. Thanks, sweetie. And we're monitoring because with HGE, she's not really been wanting to eat, so we want to make sure that she doesn't lose too much weight. Come here, sweetie. Here, it's okay. I know, honey. Come on. All right, so for mucous membranes, you want the color to be pink. You want to check and make sure that they're nice and moist, not tacky or dry. A lot of times if they're dry, it can be a sign of dehydration. The color is gonna tell us how well her tissue perfusion is. If they're light pink or pale, it could be indicative that she's got poor circulation or anemia. Cyanotic is not a good color, and nor is injected. So I'm just gonna lift her gums here, and I'm gonna press my finger, and I'm gonna look to see that her capillary refill time is less than 2, because again, that's gonna be indicative of circulation. If it's greater than 2, she might have poor tissue perfusion. She could also be hypotensive for that. For her respirations, I'm just gonna sit here for 15 seconds. I'm gonna watch her breathe, count that, and then multiply it by 4. So, all right. So I'm going to take 7, multiply that times 4, and I've got 28, which is normal. You want dogs to be in a range of 16 to 32. Smaller the dog, they might have a little bit of a higher respiration rate, but hers is going to be 28. And then for pulses, I'm going to come back and feel her femoral pulses. So I'm going to take my 2 fingers, and I'm going to go high up on the inside of her leg here and just apply a little bit of pressure. And I'm gonna again count to 15 seconds and multiply that by 4. All right, so I got 20, and times 4 is gonna be 80. So her pulse rate is 80. When I'm feeling pulses, you want a nice strong pulse. They can be described as weak, bounding, snappy, things like that. Later when I go to do her heart and lung auscultation, you'll want to feel the pulses as well when you're listening to her heart to make sure that both are in sync with each other. Otherwise, if we've got something snappy, we're going to have concerns if she's dehydrated, hypotensive. We just want to make sure that those two align well. And then for this last part, we're going to do her temperature. So we're going to do that rectally. Pulse rate was 80, which is good depending on the size of the dog. The larger the dog, they might have a lower pulse rate. Smaller dogs are going to have a larger pulse rate. So for hers, 80 is good. We want 60 to 120 is going to be in the normal range. So I'm going to check her temperature rectally. So I've got my clean thermometer here. I put a nice amount of lube. Her temperature was a little lower earlier, which is why we're monitoring it every 2 hours right now to make sure it's come back up. I know, honey. It's okay. She's probably sore back there with the amount of loose stool that she's having. And her temperature is back up to 101 even, so that's good. For dogs and cats, you're looking at a temperature from 100 to 102.2 to be in the normal range. Earlier she was 97.5 and then up to 98.9, so we were supplementing her body heat to get her back up to a normal range, which is working well. Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be showing you and demonstrating how to do a lung and heart auscultation of a canine patient. So I have got Rigby here, who has been hospitalized for HGE, and so we're going to start with the heart auscultations. Okay, now that we are in a more quiet location, I'm again going to take my stethoscope, place it on both sides of where her elbow or costochondral joint meets her rib cage, and that's about where you're going to hear the heart. I'll move it around slightly to be able to listen to the different valves. And like I said, I want to hear a nice lub-dub, no whooshing, no muffled sounds, no galloping rhythms, and make sure that the heartbeat that I'm hearing is matching her pulse quality and strength. Okay, now I'm going to move to the other side. And again, placing it costochondral space and 2 fingers on the inside of her stifle to palpate those pulses. Okay, no abnormal heart sounds. Pulses do feel a bit weaker though than what her heart sounds like. So that is something that I'm going to notate and mention to the doctor. Now I'm going to move on to her lung auscultation. So the lungs are divided into 9 different quadrants. So I will take the small part of my bell, and essentially I'm going to listen for 2 to 3 respiratory cycles as she breathes. And I'm going to be listening here. So 1, 2, 2, 3, 4, 5, 6, 7, 8, 9 are pretty low on both sides. And again, I'm going to want to be listening for abnormalities like wheezes, crackles, things that might be, or muffled sounds. So that could indicate a pneumothorax if I'm listening more towards the caudal end and it's muffled. We could have pleural effusion. There could be a number of things, which is why you want to listen to both sides and note any abnormalities that you're hearing. The other thing that I'm going to be watching for as well is her respiratory effort as she breathes. So I want to make sure that she doesn't have any abdominal breathing or increased effort, because that would be as abnormal as well. Okay, moving over to the other side now. Ideally, if she were just standing on her own still, I'd just be able to move my bell over to the other side and keep going along. Since she's pretty lethargic with her diagnosis of HGE, she does need some help standing. So again, starting over here. And I'm not hearing any abnormalities. Her lungs sound nice and clear. Breath sounds are really clear, no crackles, wheezes. Stridor, stridor is going to be heard more in the upper airway. So I don't hear any signs of anything going on within her thorax.